How's it going, guys? Difficult question for Neuro. Before we get started, please subscribe to my channel. I really appreciate it. Give the video a like, really appreciate it. 31-year-old woman, 2-month history, intractable need to move her legs and feet at night in bed. And this has awoken her husband on numerous occasions, and they're starting to sleep in separate rooms. She has low hemoglobin at 10, should be 12 to 17.5 in menstruating women, 13 to 17.5 non-menstruating women and men. MCV is low at 72, should be 80 to 100. Vitals are normal. What's the most likely explanation for the patient's presentation? Choice A, decreased tyrosine hydroxylase activity, correct answer. So this patient has restless leg syndrome, and you need to know for USMLE that the most common cause is iron deficiency anemia. Iron is a cofactor for tyrosine hydroxylase, which is needed ultimately for dopamine synthesis. Now, the activity in which iron has in tyrosine hydroxylase is not ubiquitously even throughout the body. There's different pathways that are affected more than others. For instance, you get pica, eating ice, clay, starch. That's due to disruption of dopamine within the mesolimbic, the reward pathway in the brain. So you get urges to eat strange things. Well, you also get decreased dopaminergic activity within an obscure dopamine pathway called A11 hypothalamic pathway that runs down to the dorsal horn of the spinal cord. And if this pathway is disrupted, then you get too much sensory activity, especially at night, relaying back up to the brain, and it causes restless leg syndrome. Call it weird all you want. USMLE wants you to know that iron deficiency anemia is the most common cause. And if iron levels are normal, then you go on to simply give gabapentin or a dopamine 2 agonist, such as ropinirole or pramipexole. Now, they also want you to know for USMLE that these patients are at increased risk of Parkinson's disease later in life. Makes sense if dopaminergic signaling is abnormal. Not all patients have iron deficiency anemia with RLS, but if they do end up developing RLS in the setting of IDA, iron deficiency anemia, there's still increased risk of Parkinson's disease later in life. So let's just hop through the other ones. Choice B, decreased glutaminergic activity on the striatum is wrong. So this is the primary motor cortex stimulating the globus pallidus and caudate nucleus to induce movements. Okay, so that's just normal part of movement, and that has nothing to do with this pathway. Wrong fucking answer. Choice C, decreased subthalamic nucleus activity is wrong. This would cause hemibolismus. So you need to know that if you get a stroke of the subthalamic nucleus, you get contralateral flailing ballistic movements, as they call them, of the limbs. Okay, it's a long fancy mechanism, but you have the subthalamic nucleus that normally is going to activate the globus pallidus internus, which in turn is going to inhibit the thalamus, and this is going to result in decreased movement. So if we can't do that, then we have too much movement. So I just want you to memorize for USMLE that if they give you hemibolismus, flailing movements of the limbs on one side of the body, they want contralateral subthalamic nucleus stroke. In this case, wrong fucking answer. Choice D, increased globus pallidus internus activity is wrong, as I just said. It's part of the striatal structures, and if you had increased activity, you would inhibit the thalamus and you would have decreased movement overall. This is a discussion as far as Parkinsonism, Parkinson's disease. I've made Instagram reels on this stuff, but it's nothing related to restless leg syndrome. Choice C, Parkinson's disease. I mean, I'm just being an asshole throwing it in there. As I just inculcated, there's increased risk of developing Parkinson's disease later in life, but this patient doesn't have Parkinsonism. No reason to think that that's a diagnosis here. So you do have the substantia nigra pars compacta of the midbrain. There's going to be some of those neurons that ultimately are going to be dependent on iron with tyrosine hydroxylase, but it's the mesolimbic and the A11 hypothalamic pathways that are more dependent on iron, where we have iron deficiency. That's why we get pica and restless leg syndrome in some patients. Wrong fucking answer.